I was born in Russia, and now I shave my whole
Sir.
because I don't like it.
You call 911 and get first aid kit and AED.
Okay.
At least that's what they're saying. Because they've been separate countries so long.
Territory which is now Russia, so I have
Like a horseshoe. Here. These three fingers will rest on the side of the face. All right? Go ahead and do that. Along with me. The bottom of the mask, and then you can either use two fingers on the bony part of the chin or a bent index finger. And then we want to pinch. We want to pinch the bottom of the mask. If you don't pinch the bottom of the mask, your breath will escape there. All right? And then we're going to do head tilt chin lift. We'll hover over. We're not going to breathe into the mask. We're going to say breath one.
Breath 1,
Looking at the chest. Breath two.
breath 2.
All right? Everybody good? So this time we're going to use the AED, and then you're going to follow my AED, doing 5 rounds of CPR following my AED, and then when you do the breaths, you're going to use the pocket mask, okay? Now, when you go back to compressions, do you need to remove this mask?
I know.
No, you don't.
Well, it's probably gonna fall off. Your chest can
Not always.
No?
Look. Okay? So, what I say is, if you're outdoors and you feel if it did fall off and roll away from you, then I would put it between me and them. Otherwise, you can leave it there. Then it becomes more efficient. As soon as you you're here, giving breaths, back here. In my other class, my BLS class, American Heart Association says for every 10% of efficiency gain, there's 11% more chance of survival. Okay? All right, so go ahead and remove the mask for now. All right, the AED arrived. Open it up. So hold on, have a seat. Then you turn it on.
Remove clothing from the patient's
If
chest.
you haven't already, you remove clothing.
Open packet and apply pads onto patient's bare skin.
All right, now open up your kit. You'll notice there's a pad on each side. One pad will go on the right side of the chest, under the collarbone, above the nipple. Boom, there, okay? Go ahead and place your pads. The other pad will go under the arm, up against the bottom of the chest muscle, here, with this front edge lined up with the nipple line, vertically. So your pad should look like this. Here, between the collarbone, not touching the collarbone, not touching the nipple. Here,
Not touching the
horizontal. See horizontal?
So the
Up
edge
against the bottom of the chest muscle, with this front edge lined up vertically with the nipple. Okay?
So not touching the nipple.
Okay, once everybody has their pads in place, I
On the
want you
left?
to look at your partners.
In here or in here?
Compare them together and compare them
See?
against mine. Make
Oh,
sure they
you're using,
match mine.
this is the wrong one. See how this one says it's for the bottom?
Oh, there's
So
a
that
picture.
one.
I'm sorry, this should come up here.
The nipple right there, kind of like
And
shoulder.
here, once, and this.
And then that one is. So the edge of it goes where the nipple is.
Wow.
Okay.
Careful, there is a picture on the top of your nipple and the edge of it. Oopsie.
All right, once your pads are in place, you want to make sure you press them on Make sure you have good skin contact. If you don't have good skin contact, we will not go to the next step. Okay? So press them, make sure they have good skin contact.
Apply. Do not touch the patient. Analyzing heart rhythm.
Clear.
Hands are up.
Do not touch the
So
patient.
audibly, you want to stay clear. Visually, you want to have our hands up
Advised.
to indicate not to touch.
Do not touch the patient. Press the flashing shock button.
Clear?
Clear.
Hands
Press
are up.
the shock button now.
Then we'll press the shock button.
Shock delivered.
All right. Give you credibility. Certified Red Cross, first aid CPR. I'm going to attempt to take care of your bleeding. Is that okay? You say yes. Make sure you get your PPE on. And then you'll grab one of the pads. You'll grab your pad. Let's say for this exercise, it's on the butt, lower part of the leg. You'll grab the pad, place it on the wound. Okay? Then you take the heel of your hand on the pad that's over the wound. Then you take your other hand, the heel goes on top, shoulders over your hands, and then you'll apply pressure. Okay? What do you do if that pad becomes saturated?
Take the top off.
Get a tourniquet.
We've only put one on, right? Okay, we got a directive from Red Cross saying it's better to put pressure than to let pressure up and put another pad on. But if you decide you want to do that, do it quickly. Never touching the bottom pad. Apply one on top, okay, and then go back to pressure immediately. Okay, what if those two get saturated?
Get a tourniquet. Because it won't.
We're only going to use a
The second one
tourniquet.
but
We're only going to use a tourniquet if
2
we
years
determine
and
it's life-threatening.
okay.
And 2 years and up, right?
Elevate the leg above the head.
No, we're going to keep doing pressure.
Okay.
If we decide we want to add another pad, we have to remove the top one, never touching the bottom one, and add another one, go back to pressure. Okay? You never stack more than two. Okay? After about 5 minutes, the bleeding should stop or slow down enough where you can bandage it up. So, take your roller bandage. We want to start at a 45-degree angle. See the 45-degree angle? Starting below the wound, we're going to wrap 2 inches above the wound.
Starting below the one. Oh, below. Oopsie.
All right, once you come around one time, you'll notice there's this piece sticking out. You want to fold that over before you come back around. And then you're going to capture that piece the second time around. What that does, it keeps it from slipping or coming loose. Then you're going to wrap, don't use all your bandage. So unwrap some.
Do you still have one available? I forgot to get one.
Yeah, I have some more. Okay, I want to show you a trick you can use if you don't have any tape or anything to secure it. So let's say you wrapped it, you wrapped 2 inches above the wound. You're gonna come around, like you come from underneath, you're gonna come around, like you're gonna go around one more time. The hand that's away from the foot, we're gonna come out about a foot. And I'm gonna take 2 fingers on the outside, on the top. Okay. Then we're gonna come back, put this against the leg, and then we're going to continue like we're wrapping in that direction. See, I'm here, I'll come around here, and now I'm going to take my fingers out from in between. Hold this like it's a single piece, and then now I have 2 ends I can tie off. See that? Good. If the person at your desk is having issues, help them out. Otherwise, I'll come around. So come out. Like you're coming around.
So we can tie it like this.
Just hold the hands here.
There.
Headed. Do you have any allergies? So that'll be the next thing. Do you have any allergies? Don't take qualities to it.
Because some of them are pads, like the gauze pad, and it has the ingredients to prevent
The gauze pads, absolutely use those.
those pads.
Because those pads, you have the good pads,
Yeah,
they have that in there, and it'll promote clot.
it kind of looks like a regular period pad, but meant for
Yeah.
that.
So you can get in when you go on the Red Cross,
Yeah.
you can get a kit that has those pads in it. Yeah, absolutely those pads. But putting powder, we've never been taught to teach that. All right, go ahead and remove the gauze. Were you good? So from now on, I know it's kind of late, but if there's something that I'm teaching that you need, come up here. Okay. I want to make sure that you use this station to do your thing. If you can salvage it and then throw it in here. If not, then throw it in my biohazard container back there. Same with the gloves. If you can salvage your gloves, salvage them because we're going to use them again. If not, I have more gloves up here. I just don't like to do this stuff. All right, we're with the infant now, so let's continue with the infant. What do you do if you're at a party and you hear someone say, "Oh my gosh, my baby's not responding"? What do you do?
Check for breathing. Check the scene and check for breathing.
Okay, we're going to check the scene for sure, but there's something we need to do before we can touch the head.
Give consent to
Get
the
consent
parent.
from the
The
parent.
parent.
My name is Peter. I'm certified Red Cross CPR first aid. I'm going to attempt to resuscitate your infant. Is that okay? If they say yes, then you can move in and help. Here's the container if you can, for those roller bandages and the pads if you can salvage it. Just throw it in there. That doesn't have to be the box.
If you have a Caesar, this one bad, this one good.
If you have a watch on, you're going to start on that side, okay? You're going to pinch the outside, never touching the inside. On the wrist. Pinch at the wrist, pull towards your fingers, the gloves inside out. You're going to roll it up, ball it up into that gloved hand, okay? Then you're going to have 2 fingers underneath, never touching the outside, look towards your fingers. Now that's inside out. It's all balled up. Okay? We're going to dispose of this responsibly. Make sure you dispose it in the biohazard container, or you could buy these bags that say biohazard, put it in there and seal it. If you don't have any of those, get Ziploc bags. Put it in there, zip it up, write biohazard, throw it away, or you can buy those stickers, put on it, it says biohazard. Yeah? All right. Any questions?
What happened? We're at the mall. We don't have all those stuff.
What stuff?
All those.
What stuff are you talking about?
Like the biohazard.
the Ziploc and the.
I mean, in order to wrap it, you had to have your first aid kit, right?
Oh, it's in
It's in
first
your
aid
first
kit
aid
will
kit,
be
yeah.
there. Okay.
Don't try to trick me. That was the first time someone asked me.
Thank you.
All right? So make sure you have them in your first aid kit. Something so you can put that in. All right? So how do you know if you wrapped it too tight? One way is you just look at it and see if it's discolored. If you're discoloration, rewrap it looser. The other way, unless you have fingernail polish, you can pinch your fingernail, let it go, and the color comes back. We'll do the same thing here. If it doesn't come back right away, that means you have pour cap refilled. You need to rewrap it. Okay, looser. The other way is if they complain. It's too tight. You idiot. Rewrap it. Okay? You have a question?
Should we remove their shoe when we're treating that area so that we kind of know based on their circulation?
Well, it depends on where the cut is. If there's room in between their foot,
Yeah.
you can still pinch there.
Still pinch it.
Yeah, and see if you have a cap refill. Okay? So let me put it this way. Use your best judgment. Put the tip of your thumb up against that nipple on the breastbone here. And then remove that finger. Put your other thumb up against, next to it, and then put your hands around back. Make sure your thumbs are together like this. We don't want to be across compressing the rib cage. Have your thumbs together as much as possible. Hands around back, compress it. Okay? But here's the thing. Make sure the tips of your thumbs are over the nipple line. So move your thumbs back if you need to towards the stomach. You don't need to use a chair. You can do it here on the table. All right? Okay. Look up here. We're only using our thumbs. I had a student that was doing this. I'm like, you're killing my baby. All right? Only use your thumbs. The other thing is you want to have your hip where the feet are, with your hips angled away from the infant. Here's why. Because when you get to 30, you're going to rotate on your feet, give your mouth to nose, and then you're going to rotate back to here. Never taking a step, just rotating on your feet. Okay? You need to move your chair out of the way. Move your chair out of the way so it gives you more space.
Grade 1.
Right?
It's normal position, right? We do not open airway, right?
Yeah, it's the same. But for them, it's a little less because they're like smaller.
Oh.
To see how like.
Oh, I thought normal position. It's not? A little bit?
Yeah.
Turn it on.
Remember, you want to get complete chest
Oh
recoil.
wait. Oh, mine wasn't.
If you have a divot in the chest when you're doing your next one, you haven't got your thumbs up high enough. Okay? Remember it's two hands, open the airway, one on the forehead, the other one under the chin, open the airway. You're going to seal your lips around the mouth and nose, but not today.
Grade 1.
For the infant, it's neutral, right?
Yeah, we're going to neutral.
So there's no tilting.
It's almost a little, just very little tilt on these mannequins.
Okay.
Okay, look at me. Normally an infant would have their chin pretty much on their chest.
Okay.
You'd have to lift it up to
Take
neutral.
it to neutral.
Remember, the chin is like pointing straight,
Okay.
parallel. With an adult, the chin's angling at the roof or ceiling, right? So we don't want to angle at
So
the ceiling.
just
we want to be
natural that
neutral.
the baby is not like this. Natural.
When would we use this bag on an infant?
So you would,
You wouldn't?
no. But you wouldn't do the pocket mask. All right. Time out. Go ahead and go in your groups. grab your instructions. Go ahead and go.
The same with the lights?
Yeah.
Yeah, check the scene for safety and form an initial impression of pain concern from parent and guardian.
My name is Sari. I am certified Red Cross CPR first aid kit.
Okay.
Can I help your baby with this breathing?
Yes.
Thank you.
If the infant appears unresponsive, check for responsive.
Repeat, sir.
We attempt to resuscitate.
Oh,
Because
can I attempt to resuscitate your baby? Yes. Thank you. Baby.
Check for responsive breathing, life-threatening bleeding, or other life-threatening conditions using shot and tap. If the infant is non-responsive and is not breathing or only gasping, call 911 and get equipment or tell someone to do so.
Baby, he's not responding. Please, you call 911.
Okay.
Get the AED and first aid kit.
Okay. Place the infant on their back with firm flat surface. Give dirty chest compressions.
Breathe 1, breathe 2. So for baby, our mouth have to be all the way cover the nose and the
Yeah,
mouth.
because then that means your cheek is going to cover the nose.
Repeat.
Your cheek will cover the nose.
Oh, my cheek will cover the nose. So I do like this.
Yes. Good job.
Thank you. So I have to do thumb exercise too.
Yes.
Ooh, red. Breathe 1, breathe 2. Baby usually like this, so we just make it in a neutral position.
Like that, and neutral for the blood. Everyone's like straight.
So just a neutral position, right?
Yeah.
same as the adult, goes on the bridge of the nose, finger and index finger. Here, pinching the bottom. Open to neutral, you give her breaths. Okay? Alright? Alright, also the AED arrived. So, let me start it.
Remove clothing from the patient's chest.
We have it already, remove clothing.
Open packet and apply pads onto patient's bare skin.
Alright, we already looked at the pads, we know where they go. But here's the thing, look at me up here. I want you to treat the mannequin like it's a real child. I had one student put the pad in front and he did this. That's not what you do, okay? We want you to, here's what I would do. So, moms, take the stuff. Moms, I would put my hand under the head, low towards me, put the pad on. Is that right? Is that what you would do? Remember, you're controlling the head, protecting the neck. All right, the pads, the one that goes on the chest, you want it almost against the neck. You want to try to get the center of the pad, the midpoint of the pad, as close to the nipple line as possible without touching the neck. Okay? And on the back, see that notch on the back? You're going to cover that notch, at least that's how high you want to be. Okay? You want the center of the midpoint of that pad to be as close to the heart as possible. Okay? All right, I want to see, make sure everybody, have your pad go higher. See that notch on the back? You want to cover the notch. Okay, I'm going to see who the moms are here on today. Cover that notch. Make sure your pad covers the notch. Yeah, that's how high you need to be.
In here?
Mm-hmm.
Right, just like the adult, we're gonna clear when we analyze, then we'll clear when we shock. So from now on, I'm gonna let it run the rest of the way. We're gonna do 5 rounds of CPR, okay? Press play. We'll put this on the side so you guys can hear it better. All right, here we go.
Apply pads as shown. Do not touch the patient.
Clear?
Analyzing
Clear.
heart rhythm.
Hands up.
Do not touch the patient. Analyzing heart rhythm. Shock advised. Do not touch the patient. Press the flashing shock button.
Clear?
Clear.
Hands up.
Press the shock button now. Shock
Thumbs in
delivered.
place.
Begin CPR.
Follow the metronome. Go. Make sure the tips of your thumbs are up against the implant.
20.
20.
30. Give 2 breaths.
Too fast.
1. Go 2. Hands in place. Go.
10.
20. Make sure you're getting complete chest recoil.
30. Give 2 breaths.
Try to pivot on your feet instead of taking steps. Hands in place. Go.
10. 20. 30. Give 2 breaths.
1. Make sure you're pinching the
Break
bottom of the
2.
mask.
10. 20.
Take chest recoil. Just use your thumbs.
30. Give 2 breaths.
2 breaths.
Make sure we pinch. Close the bottom.
Hands in
Right.
place.
10.
10.
20. 30. Give 2 breaths.
Close.
Stop CPR. Do not touch the patient. Analyzing
Clear?
heart rhythm.
Hands are up.
Do not touch the patient. Analyzing heart rhythm.
All right, good job. Go ahead and remove the pads. Any questions? Doing CPR on them.
Almost on the neck. And down here.
The ears, because we don't want you to slip onto the throat. So we're here. These 3 fingers will rest on the shoulder. We're controlling the head, protecting the neck, right? And then I'm going to rotate to my forearm, just like this. Straddling my forearm, a leg on each side. Resting on your thigh, head lower than the chest. Using the heel of your hand. If you use the palm of the hand, your fingers could hit the back of the head. So heel of the hand, 1, 2, 3, 4. Rest on your thigh. Okay? Resting on your thigh. Imagine the infant is going to be way heavier than this, struggling for air. So you want that support. Don't cross your legs, because we're going to cup the back of the head. Cup the back of the head. Then we're going to, right here, it's just a quick, like this. Resting on your thigh. Straddling your forearm. Rest on the other thigh. Come on this side. Make sure you have the leg on each side. Straddling your forearm. 2 fingers on the breastbone. Okay? Along the breastbone. So if you have to put your elbow out so you're along the breastbone, do that. Same place you do compressions for CPR. 1, 2, 3, 4, 5. Back on the chin. Rotate face down. Okay, I want you guys to do 3 rounds of back slaps, chest compressions. Okay, hold on. And 3, 2, 1, go. Rotate. Remember, you're cupping the back of the head. We're protecting the neck by controlling the head. When you're done, place the infant on the table.
On the right side.
.90-degree angle, the baby like this, or do you allow gravity to kind of assist?
Gravity.
Gravity, so it's like
You
an
want,
angle.
you want the head lower than the chest. So gravity will help when you're doing the back slaps.
When do we check with the pinky?
chest.
Every turn or every cycle? You don't.
So if they become unresponsive, put them on a flat surface. Compressions with the thumb circling hands. When you get to 30, you open the airway, then you look for the object. That's when you use the pinky to scoop it out, only if you see it. If you don't see it, you're not going to go looking for it because you can push it deeper in. Okay? So we're not going to use our pinky unless we see the object in the mouth. Okay? Any questions? Everybody good? All right, give yourself a hand.